So today I'm going to look at this paper in the European Heart Journal. So we can see from the title that they're doing an analysis of carbon emissions from aortic valve replacements, and they're comparing the footprint of the transcatheter and surgical procedures. So we can see from the abstract they make a point that the impact of climate change is recognised as a major public health determinant, but it's not necessarily always a negative impact. As I've shown on a previous video, actually in the UK it's estimated that warming is actually reduced in fewer deaths because more people actually die from cold or associated with cold than they do with heat. So we can see there that they're comparing SAVR, which is the surgical valve replacement, with the transcatheter valve replacement, TAVR, either done in the operating room or the cath lab. So basically, they calculating how many kilos of CO2 are emitted with these procedures, which is this bit here. And we can see that the two TAVR ones have got the lower emissions compared to SAVR, which is a fair bit higher. And then in conclusion, they're saying that because the footprint of the surgical valve replacement is about twice as high as the others, that these findings should be potentially considered when making population level decisions and guidelines moving into the future. So what they seem to be saying now is that basically we should consider the CO2 emissions of these procedures. Now, I would have thought it's normal to actually look at this from a purely clinical point of view. I found this paper here, which is comparing outcomes with low-risk patients with these different procedures. And actually, in this case here, from the conclusion, we can see that actually the transcatheter one, which happens to be the ones with lower carbon emissions, was actually better from a clinical point of view. So, but if it was the other way around, you certainly wouldn't want your doctor, if you were in need of one of these procedures, to be picking the procedure which has a lower carbon footprint. I mean, we're talking, for one of these procedures, we're talking about just, as we can see, a few hundred kilos of CO2. Now, that's the impact that any one of those procedures would have on the climate based on that CO2 emission is effectively unmeasurable and not discernible. It wouldn't even amount to trying to bail out the Titanic with a thimble. It'd be, even less than that. I think what struck me about this paper, just like a paper I looked at just recently to do with Lone Star ticks, is it just seems that the you couldn't make it up department is constantly active and spreading their tentacles all over the place. It really strikes me as unbelievable that anybody involved in medicine would be thinking that you don't purely look at the clinical need for deciding the procedure, or at least in some countries, you may have to take into account costs as well, but obviously that's another matter.